book that's written for everybody so that our society ultimately will be a healthy one. Don't forget that the way the WHO defines health is that it's a state of complete physical, mental, and social well-being. So we cannot talk about health and focus only on the physical. We also have to remember that mental and social aspects are part of the definition of health. So for us to all be truly healthy in Nigeria, we have to look after our mental, physical, as well as our social well-being. That all of us have a role to play. You can be a better human being, you can smile more to your colleagues at work, be kind, and so on, to your family and so on, so that everybody feels better when they are treated well. What can be done by the federal government, such as passing legislation like the mental health bill that is supposed to update the laws guiding and regulating the practice of mental health in Nigeria. That bill needs expeditious attention, and we've been on it for over 2 decades now.
Now, this book, Optimal Mental Health, written by Dr. JUBRIL ABDULMALIK of the College of Medicine, University of UCH, is a very good book. It comes at a time when there's a gap in the advocacy, in the prevention of mental, and even in the treatment, because there's a gap. Not many people that fall sick, that have mental health problems, know where they should go. And in case, for example, what happened in Kaduna recently, and it's not only in Kaduna, we know there are so many centers where people are being chained down. And the question is, would anybody want a child, his or her own child, to go and be chained down like that, in that condition? No.
Without clothes, for you to say you have a mental illness. If you read this book, you will understand that you don't have to be mentally sick for you to be having problems of mental well-being, and that mental well-being is not a mere absence of mental illness. There are things that you're supposed to have that will say that you have a guaranteed mental well-being. Suicide is within the realm of mental health, and most of the factors that will lead someone to commit suicide are related to your mental well-being. So if you read this book, you will see there things you can do that can promote your mental well-being, that can prevent you from thinking of suicide.
To raise a lot of awareness and reduce the ignorance, the shame, and the embarrassment that is associated with mental illness. From the book, I've learned that more than 50 million Nigerians can be exposed to a wide variety of mental illness, from depression to those who need psychiatric needs and co. And that only 20% of us have access to mental illness treatment. So clearly it's important that we begin to raise awareness and do advocacy to improve education and reduce the shame and embarrassment that people associate with mental illness.